Here's a question from a mother. She's saying, my 8-year-old daughter always has sweating in her palms. It's wets the and dirties the paper also while she is writing. So she's asking whether this is normal or whether they have to think something or do something about it.
Okay. Okay. So this is something known as palmoplantar hyperhidrosis. Uh, it's an 8-year-old child. So this is as early. For how long has she been having it?
She's 8-year-old, so maybe 2, 3 years
Okay.
now.
The duration has not
Yeah,
been mentioned.
yeah.
Yeah. Okay. So that's how early it begins. So the sweat glands on the palms and soles, they'll be very easily stimulated. Even a little bit of stress will cause it to, sweat a lot. And this is exactly the way patients come to me with, they can't write their exams. It's literally dripping. It's like this water is just dripping from their hands when they're writing. So is it normal? It's not normal, but is it something to be worried about? Is it, in the sense, is it a sign of something else that's going wrong in the body? No, it's not. It's just that they have very hyperactive sweat glands in the palms and soles. So what can be done about it? Well, there are a few treatments available. So step by step, we have a lotion that can be applied to the palms and soles. It's an aluminum-based salt. So a lot of people do see results with it. If they're not seeing results with it, the next step is to go for Botox injections. Well, Botox injections are used for anti-aging purposes to smoothen out wrinkles. So the same Botox injections can be injected to the palms, and they will, decrease the sensitivity of the sweat glands. But Botox injections are not a permanent solution. They will have to be given every 6 months. If it is acceptable to the patient, yes, we go ahead with that. And then there is something known as iontophoresis. So basically, we pass an electric current through the palms and the feet. So this is done on every alternate day. People do see results in about a month or two, and this will have to be continued for life every week. If it's working, this is what I suggest. This can be done at home. If even this is not working, that's when we go in for invasive procedures. So there are two invasive procedures. One is something known as microneedling RF. There we have multiple needles going into the palms. Of course, the palms will be anesthetized. They go in and then an electric current is passed. So that causes a destruction of the sweat glands present deeper within the skin. So about 3 to 4 sessions done 4 weeks apart gives a good level of improvement, which does get sustained for years. Maybe one maintenance session may have to be done every 2, 3 years. If even this is not helping, there is a very radical procedure known as endoscopic thoracic sympathectomy. So what happens is the actual nerves which are involved in stimulating these glands are present inside the thorax, inside the chest. So using an endoscope, this can be accessed and these nerves are cut off. So this is a very radical procedure, but this is what is the final treatment for this.
Okay. Thank you, doctor. So that means there are multiple levels of solutions possible.
Yes.
Anyhow, people need not worry because it's normal or it can be treated.
It can be treated and it's not a sign of anything that's going wrong inside.